Are you considering EMDR therapy but unsure about if it's right for you? Maybe you've heard that it's different from other types of therapy like DBT or CBT or solution focused brief therapy, but you're wondering, how does it actually work? Will it really help me? Well, today we are in part four of our EMDR series, and we're going to explore how EMDR stands out, how it is different, and address some common concerns and set up some clear expectations, including whether EMDR is actually the right fit for you so that you could feel informed and confident and ready to make a decision about the right choice for you in your healing journey. I'm Kitty. I am a trauma specialist in private practice right here in Central Texas, and I make educational videos about mental health with real talk for real people just like you. I draw from my lived experience of trauma and recovery, along with my clinical expertise as an EMDR certified therapist. All right, let's dive in. In order to understand how EMDR works and what makes it unique, let's look at a little bit about the brain and how it processes trauma differently from other approaches. CBT and DBT, that would be cognitive behavioral therapy and dialectical behavioral therapy, they focus on the thinking brain. So the prefrontal cortex is the logic center of our brain, and that part of our brain helps us analyze, reframe, manage our thoughts and behaviors in the present. These approaches are great for creating and developing practical skills and immediate relief. Person-centered therapy by Carl Rogers, on the other hand, emphasizes the importance of safe and empathetic space for emotional growth within the therapeutic alliance or the relationship with your therapist. So it's going to focus more on that emotional exploration than specific symptom relief. EMDR, on the other hand, targets the emotional brain, the amygdala, and the memory processing system in the hippocampus. It works with your brain's natural healing process in order to reprocess traumatic memories that are stuck in kind of that emergency zone, that activated state. It's kind of like moving a messy file from your desk to a long-term storage folder where it no longer overwhelms you. EMDR is also different because it uses eye movements or tapping or the tappers to engage the brain's adaptive information processing system, allowing it to heal without the need for extensive verbal processing. So this would be kind of the difference where people have done maybe CBT or humanistic therapy before, and they've done that talk therapy. That feels like this is not that. There actually can be sessions in which there's not a lot of talking at all. So it is quite different in that way. We're not just outside talking about what's going on for you, but kind of going inward a little bit more. A common fear that people have about EMDR is that they're going to have to relive or be forced to re-experience painful memories. And the truth is that while you'll focus on a specific memory, EMDR isn't about reliving it. It's about reprocessing it and metabolizing it in a way that wasn't allowed to be completed before. So a skilled therapist is going to help you stay grounded and safe throughout the process. Think of it as kind of a memory that gives you anxiety, maybe on a scale of 0 to 10, but you're still within your window of tolerance. If you're feeling outside of that, like it feels like a 15 or a 20, that's not going to be a memory that they're going to have you relive and re-experience. So how is it different from other modalities that you've tried? Well, unlike CBT or DBT, EMDR doesn't require you to analyze your thoughts or behaviors extensively. It works directly with the stuck memories causing the distress that's staying active, and that's what your emotional system is still reacting to. So trauma is like emotional flashbacks. So we're getting right at the heart of those emotional flashbacks. This is going to help you reprocess those memories on a deeper neurobiological level. A lot of times people have concerns like, will it work for me? Well, it's really highly effective for many, many people, especially those dealing with trauma. It's not a one size fits all solution. And a good therapist will help you determine if EMDR is the right fit for your needs. Now, I'm going to say something that's going to get me in hot water with a whole bunch of EMDR therapists, but EMDR isn't for everybody. Just like cognitive behavioral therapy or dialectical behavioral therapy, there is no one size fits all. Unfortunately, I wish there was, but there's not. And so it's okay if you're like, I really hate this modality, I don't like it. You get to say that. It's not a one size fits all. There are lots and lots of ways that you can process your trauma. A lot of times people wonder, how long will it take? Well, it can work faster than traditional talk therapy for single event traumas, but more complex issues may take longer, just like in any modality. So the process moves at your pace, and your therapist will adjust based on what you and your system and your life need. A couple things to understand before starting EMDR therapy. One is that it is an 8-phase process, structured into 8 phases, from history taking to closure, reevaluation, reprocessing. Your therapist will guide you through each step, starting with building safety and trust and rapport, because that is the number one most important thing. Even if you're doing EMDR, if you don't feel safe with your therapist, it's not going to work. Set very clear goals with your therapist. So be clear about what you want to work on, whether it's a specific traumatic experience, whether it's a feeling like anxiety, self esteem issues. EMDR works best when you have clear goals, clear, measurable things that you want to have more of or less of. I want less anxiety and more self advocacy, something like that. Doesn't have to be like super detailed, but just kind of generally, I want more of this and less of that. Okay. Be prepared for this to be an emotional journey. Anytime, no matter how you're working on your trauma, anytime you're working on trauma, it's going to be emotional. There's going to be feelings. So I like to tell people to ask yourself this one question first, and that is now the time? If you're in the middle of getting married, having a baby, switching jobs, or you've just lost your job, now may not be the best time for you to work on your trauma. So think about that. Can your life handle a skosh, a little bit of instability, possibly, before diving into trauma work? Because if you don't have the bandwidth and the stability in your life to tolerate this work, then it's going to be more traumatizing for you. Your therapist should teach you tools to keep you grounded, safe, and stable, though. So just let them know and work in partnership with your therapist. Embrace patience. Healing takes time. Rome wasn't built in a day, and trauma healing will not happen in a day or in just a few sessions. It may take some time, so just have a little bit of patience through that process. EMDR is very effective for people who are dealing with unresolved trauma, single event trauma, PTSD, car accidents, assaults, chronic negative beliefs, right? Like that voice in your head that's saying, you're an idiot, you're not good enough, all those things, you're dumb, you're ugly, whatever it is. EMDR is really great for those kinds of issues. Anxiety, phobias, grief linked to past experiences, like when you lost a loved one, something like that, or those who struggle to verbalize and talk through their pain. So EMDR does not require extensive dialogue. So it can be really, really helpful for those who talk therapy hasn't worked for before, who aren't verbal processors, who don't want to come in and talk out loud. Now it can work for those who do, but just kind of know that about yourself. If you're someone who likes to go into therapy and kind of brain dump, word vomit, just talk for 50 minutes, that's not going to help you with EMDR therapy, because that is really a dialogue between setting those goals between you and your therapist or things like that. If you come in and you just talk for 50 minutes straight, we're not going to get the clarity that we need. And maybe a different modality like talk therapy would be better suited for you, or narrative therapy even. But just know that for EMDR to work, we're going to have kind of some dialogue, a back and forth, things like that. It is Not necessarily ideal for people who are in the midst of active crisis. So, if you're experiencing acute chronic suicidal ideation, severe substance abuse or misuse, unstable housing situations, now may not be the time to do EMDR. If you have a really difficult time staying grounded, then you're going to need to develop some of those skills before you move into the reprocessing phases of EMDR. So just know if it feels like it's taking a long time to get to the reprocessing phase, that might be part of why. If you get really dysregulated, then we're going to have to go slow so that you can be safe, stable, and in your wheelhouse, or what I like to call your window of tolerance. Sometimes people have a stuck belief that it won't work for them, or that they don't really want to address, or they're not ready to let go of their trauma. They want to feel better, but they're not quite ready to let go. But we're not going to do reprocessing for individuals like that. We're going to wait until they're ready to let go of those things, or there's a willingness to let go. Sometimes it's really scary when we've held on to our trauma for so long, or if we have a belief that we can't get better no matter what, then it can be really hard. If that's your identity, it feels like I'm losing a friend, I'm losing a partner, right? So we got to get you ready for that first, if EMDR is what you choose to do moving forward. EMDR is a really unique therapy model. It's quite different from CBT, humanistic, narrative, DBT, as all the acronyms, right? This is its own acronym, EMDR. And it's different than the other ones. All modalities are different. And whether it works for you or not is up to you. You get to decide. But there are lots and lots of ways to heal from your trauma. If you stayed with me this far, thank you. Please like, subscribe, share, and let others have access to this free information. Remember that calm curiosity and compassion is the key to reconnecting us all in this very divided world. All right, I'll catch you next time.